Good morning, hello, or good evening, everybody. So, have you ever been worried about your weight these days? Well, if you are, let's see how to overcome the obesity or the waist legs of yours. And yes, it's been made by me. So, first of all, what's obesity? Well, it is one of the metabolic syndromes, and it happens when a person's body cannot burn all the calories he or she takes in. Well, so then, what's going to be, how is it going to be considered? It's considered obese if body mass of a person is over 30 kilograms slash meter per meter squared, and body mass could be calculated by weight over height squared. And in the US, a quarter of the US population is considered obese. And here's a pie chart as well. So what's going to the symptoms? Well, there are many. There could be breathing disorders, cancers, coronary artery disease, which is a type of heart disease, depression, low self-esteem, liver disease, high blood pressure, joint disease, stroke, and etc. There's many other stuff. So then, why obesity or metabolic syndrome happens? Well, many people say that there's a dramatic increase in the fat, sugar, and carbohydrates we take in. Well, actually, no. Well, some of the possible causes are the environmental, lifestyle, and/or genetic factors. So then, how does the unhealthy lifestyle affect? Well, one thing is that maybe you're eating in the wrong time. For example, there's a syndrome called night eating syndrome. Yeah, maybe going to the fridge and get some donuts in the night. Or little or no daily exercise, having nothing of those. And another possibility would be increase of ratio between overall omega-3 and 6 fats. Well, those omega is types of fatty acids which is especially found in marine and vegetable oils. Omega fats influence the hypothalamus and brain. Omega fat 6 creates appetite-regulating cells in the hypothalamus, which are rich in receptors for endocannabinoids that encourages the weight to increase. And the omega-3 has the opposite effect. So next, how can environmental factors cause obesity? Well, one possibility would be long-term chronic stress. Unlike when a person is alarmed, like fight or flight system, it drives the desire to eat continuously. Another could be cycle of depression. In the first step, there's going to be depression. Second step, there's going to be negative behavior, maybe eating more. Third, social rejection. Fourth, negative events, maybe, for example, being made of obese people. And fifth, low self-esteem. He or she concludes himself as an obese person. And it goes back to the step 1, depression. Or it could be the body image dissatisfaction. And these all could be symptoms of the obesity by vice versa, yeah. So then, how can obesity be caused genetically then? Well, one thing is that metabolic rate of a person is under genetic control, and if a person who has low metabolism genetically has higher possibility to gain more weight than the people who has higher metabolism genetically. So if in a situation of having an unhealthy lifestyle, then yeah, they get fat easily. and some behaviors are under genetic control, such as eating and physical activities as well. So yeah, that might explain how the obesity as good. So then, this is an important thing. Ways to treat obesity. There could be behavior control, pharmacotherapy, surgery, and I haven't noticed it there, but there's also psychotherapy as well. So first of all, there's behavior weight control. So it includes improvement of eating habits, lifestyle, and exercise. What's the effects? Well, it decreases depression and body image dissatisfaction, and it also increases self-esteem and interpersonal functioning. But there's some criticism as well. The effects are not maintained in long-term effect. Maybe like there's going to be rebound occurring to patients with food restrictions in 5 years. Well, so there's steps to control behavior as well. So the first step, you need to recognize the problem for the subject and its environment. Maybe simply he or she is at the healthy weight level when they are not. Second, they need to change the eating lifestyle including his or her environment. For example, maybe schedule regular meal times. Yeah, I have mentioned about the night eating syndrome. That's a thing you need to change. Also, you need to avoid carbohydrate-rich foods as well. And third, you need to increase the amount of physical activities as well. So you just need to exercise more. Okay, next one. Pharmacotherapy. What is this? So it is kind of therapy by using weight loss medications. So yeah, it's medication by pills. So there are usually a long-term use of two medications. For example, Orlistat, or in another name, gastrointestinal lipase inhibitor. The side effects of these are gastrointestinal, for example, loose stools or oily spotting. Also, there could be side effect of decrease of fat-soluble vitamin absorption, which leads to the multivitamin supplement recommended. And criticism of this is that it is difficult to control the risk of drug combination usage. Third one, surgery. So, common surgery to get weight loss is gastrointestinal surgery. The advantage of this surgery is that 25% to 40% of the weight loss is achieved on average. However, there's also a disadvantage as well. There's 0.3% to 1.6% of operative risk, and there are short-term risk of peritonitis and anastomotic leak at 1.6% to 2.3%. Also, there's long-term deficiencies of cholecystinosis, vitamin and minerals. And worst of all, the patients are being restricted with their eating style for a long time or period. Okay, this is the first one I didn't mention the first. Psychotherapy. So, one type of psychotherapy that we could use to overcome with obesity is cognitive behavioral therapy. For example, you could find ways to build self-esteem for yourself. Maybe it includes to forgive yourself for past mistakes, make changes to your life, and of course reward yourself. The second kind of example for psychotherapy is interpersonal therapy. It is used as one of the therapies for mood disorders such as depression. Well, the steps are that first, you need to help the patient to feel understanding that he or she is depressed. And second, that you need to show the patient the clear pathway for treatment. And third, well, the patient will lead to the success experiences and get no more depression anymore. And these are the resources I have used to search. They all are including PhD or master degrees publishers. Thank you for listening to me. It is over. And Mr. Rani, if you're listening to me, thank you very much. I'm really thanking you for teaching us for the whole year, and of course for helping me search for the university as well. Thank you very much. I will miss you.